good afternoon from the first Heartist meeting in Rome. This is the second episode of In Conversation with Knights. This afternoon we have Professor Isaacson, who has kindly joined us to answer to a quick set of questions. Thank you, Professor.
Thank you for inviting me.
First question would be, what is the kingdom you identify yourself with?
Out of the three kingdoms, I would identify myself with the hysteroscopy kingdom, but I'd like to add a fourth kingdom, which is the myometrium.
And the second question is, what is the strongest weapon as a procedure or as a technique in the kingdom you belong to regarding the management of the infertile patient?
The strongest weapon for us is any of the small diameter office hysteroscopy scopes. They could be the mini resectoscope, or it could be just the cold scissors and graspers.
Perfect. Next question would be, considering the latest recommendations for the workup of the infertile patient, is there any update or any modification that you would fight for?
I'd fight for updating for everyone to get a good three-dimensional ultrasound, or possibly even an MRI prior to at least going forward with assisted reproductive technology.
And the next question is, what is your unpopular opinion among the other knights in your kingdom regarding the management of the infertile patient?
I'm a strong believer that the uterine muscle and adenomyosis plays a strong role in infertility, and that's right now not I would say, a well-accepted opinion.
At the opposite side, next question is, what is the most medieval practice still ongoing in the management of the infertile patient?
I would say right now it's too much attention on the thin endometrium in patients who have had a hysteroscopy which is deemed to be normal, but yet they're still a thin endometrium, and there are many infertility specialists who refuse to do embryo transfers in those patients.
Excellent, thank you. Next question is, for the purpose of the win, that is reaching the fertility outcome for the patient, who could be the strongest partner among the other two kingdoms?
Definitely would be the assisted reproductive technology partner.
And the final question, a bit of a provocative question on the battlefield. Who would be the one knight that you would fight or challenge?
I would probably challenge Mark Emanuel.
And why?
Because I think too much use has been, and it's not his fault, but he developed the tissue shaver or the morcellator, and I believe it's being used inappropriately now.
Thank you very much.